Everyone, welcome back to TV5 News at 9. It's time for Medical Moments with Covenant Healthcare. So joining us this morning, please help me welcome. We have Dr. Jorge Hernandez. So Dr. Hernandez, thanks for coming in this morning.
Thank you for having me.
Of course. So we're going to talk a little bit about rectal cancer today. Can you just tell us a little bit about what it is?
Yeah, so colorectal cancer is still to this day the third most common cancer in men and women in this country, with being the second leading cause of death. So that's why it's so important to keep talking about this topic. Now, I want to talk about rectal cancer today because about 30% of all colorectal cancers are rectal cancers.
Gotcha.
So it's a significant portion of them. Now, why is the rectal cancer so different and in a way more complex than colon cancer? Well, it's all due to the location of the rectum. So you know, the large intestine is this muscular tube that measures about 5 feet for most people. The rectum being the very last portion, the last 6 inches. Now, the location in the deep pelvis, in an area where we have important structures that interfere with the function of your bladder, your sexual function, being close to the muscles that help with control, makes treatment really challenging, makes surgery a technically complex procedure, among other complexities that we can mention later on. But that's, in a nutshell, why rectal cancer is somewhat different than colon cancer.
Okay. I didn't know there was a major difference. So glad that you are here. Can you talk about the signs or symptoms that might serve as any early warning signs?
Yeah, so the most common type of rectal cancer is similar to the most common type of colon cancer. Now, some of the symptoms overlap.
Okay.
With rectal cancer in particular, rectal bleeding becomes a very important symptom, and I want to emphasize this to our audience. Any patient, regardless of age, especially this is a message for younger patients, with rectal bleeding should seek medical attention. You know, their primary care physician should do an evaluation, and even after that, if they continue to have this symptom, they should not neglect it. It's really sad and unfortunately a very common problem when patients come to our office and they've been having rectal bleeding for years.
Oh my gosh.
And it's due to cancer. So it would be very reassuring to have an exam by a specialist, and then we can either find a source for the rectal bleeding and treat it, or we can proceed with other testing, screening tests for colorectal cancer. There are other symptoms that are important, like changing your bowel habits. Sometimes patients develop diarrhea, urgency, all of a sudden constipation, changing the caliber of the stools. So those are signs to pay attention to. Now, there are more advanced signs and symptoms.
Okay.
Typically, they correlate with more advanced cancer stages. So weight loss, change in your appetite and your energy level. But ideally, if you see early signs, please seek medical attention.
Absolutely. How important is screening, and when should someone get screened?
Well, it's so important because colorectal cancer in general is preventable and curable. Colon and rectal cancer arises from this growth in the inner lining of the large intestine, or polyps. They can have different shapes, like they can be mushroom-like, flat, but all or the majority of colorectal cancers arise from this. So if we can detect them when they're early, when they're small, and remove them, then we can prevent colon cancer. Now, the guidelines in this country have decreased the starting age for average risk patients to 45 years of age. Why 45? Because we have seen a trend in the incidence of colorectal cancer in younger patients for the last 20, 30 years. And unfortunately, even though the incidence is still small compared to older populations, it keeps increasing. So we start at 45 for average risk patients. If you have family history of colon cancer or inflammatory bowel disease or other conditions that increase your risk, the starting age could be even sooner than that.
Okay. Very good. We want to talk about NAPRC certification, and what resources does Covenant have in order to help those with rectal cancer?
Yeah, so the National Accreditation Program for Rectal Cancer was created in this country after identifying a disparity in outcomes for rectal cancer care. We realized that the outcomes were highly variable and contingent on a specialization of the center, volume of patients treated in that center, expertise of the physicians. And we, in a way, were lagging other countries, for example, in Europe, in terms of these outcomes. For example, the quality of surgery, highly variable. If you go to a center where surgeons encounter multiple cases a year, the rate of permanent ostomy, so as the result of rectal cancer treatment, some patients can end up with a permanent bag. And in centers without the proper expertise, that rate is higher.
Okay.
Also, the rate of recurrence after treatment, and even the survival. So they all depend on the expertise of the center, the volume, the specialization. So that's why this NAPRC accreditation was created to try to standardize care and outcomes for rectal cancer in this country. Now, at Covenant, we were one of the first 2 centers in Michigan, in the entire Michigan, to gain this accreditation.
Nice.
And now, for several years, we've been working with an excellent group of physicians, nurses, support staff. We work in a multidisciplinary fashion to approach these complex cases of rectal cancer. Like I said, management becomes challenging. For example, when, like I said, you have colon cancer, the majority of patients go on to have surgery if the cancer hasn't spread at diagnosis, and then from there, they can receive treatment after surgery. Now, with rectal cancer, often patients require chemotherapy, radiation, even before treatment. The diagnostic tests, like MRIs, are highly specialized, so relies on a very, the expertise of a radiologist that is used to reading these MRIs. The techniques are difficult. The decision to treat, again, is complex and involve a multidisciplinary team.
With you describing that, what would you say maybe to a patient who maybe is like, well, it seems so complicated, so I'm just not going to bother? What would you say to them? Well,
it's a complex process. It takes a long time, but the most important thing is that they need to understand and realize that we have the expertise to cure them from this process.
Okay.
It will take a long time, but with our team, we can guarantee that the outcomes are going to be as good as anywhere else in the country with this type of expertise.
Anything else you want us to know, Dr. Hernandez?
Well, I think the main point to stress for an audience today is, number one, to not neglect early symptoms of colorectal cancer. Number two, to get a screening test. Nowadays, there are even non-invasive tests, not necessarily only colonoscopy, but the majority of patients that, for the last few years that I've been a colorectal surgeon, that come to see me with this problem, have never had a colonoscopy. And that story keeps repeating itself. So please go and get your screening test for colorectal cancer, and don't neglect early signs and symptoms.
Perfect. Thank you for your time this morning.
Thank you, my pleasure.
Yes, of course. We love having you. And if you need any more information on today's topic, you can head over to our hot links page on our website, WNEM.com.